Deputy Micheál Martin, please.
Thank you, Taoiseach. This has been one of the worst weeks in the history of the Irish Health Service, wrote Susan Micheál of the Sunday Business Post at the weekend. I think she was summing up what was an understandable anger at how Vicky Phelan was treated, over the failure to tell women the truth in terms of their misdiagnosis, the forcing a sick woman through the courts, and then questions around the quality of our National Cervical Cancer Screening Programme. And it's fair and objective to say that the response of the HSE Directorate, the Department and the Minister in the early days compounded the crisis. No one appeared to be in charge, and the women were justifiably worried, anxious and angry. And there are still major issues, Taoiseach, that have yet to be sorted out. I would put it to you that GPs have yet to be properly advised and resourced and prepared to respond to this crisis. The helpline has been way behind and has not been effective. I know people were in over the weekend, but thousands of people are awaiting a call back, and indeed some reports we got this morning, some women more worried after the call than before the call. Clearly a rushed initiative, not properly resourced at all. And then many promises have been made. So, for example, Taoiseach, will every woman that asks for one get a free smear test, as announced last week? Is that the initially correct response? Does the capacity actually exist to do that? What criteria has been given to GPs to select and refer women for further smear tests? I put it to Taoiseach that surely an initiative should be taken to proactively target women who are at higher risk of cervical cancer in an initial look back, because there could be women with abnormalities and precancerous cells walking around today with false negatives. So some consideration needs to be given to this. A look back programme that would focus on women at high risk, I think, should be considered. We welcome the inquiry, but given the role of the department, the inquiry should report back either to an Taoiseach's office or indeed to a separate department. There is precedent for that. Taoiseach, while focusing on an inquiry, we must be conscious of the victims of this scandal, the women whose screenings were misread on a number of occasions and whose voices we must listen to. I was contacted by one of those 209 women this week. Her tests were missed on a number of occasions on an annual basis. She had to have a radical hysterectomy which could have been avoided. She was not told of this until late last week. And I quote from her, "The impact of finding out that cancerous cells were running around our systems for longer than we thought, in some cases years, due to the missed scans, only raises fears of recurrence." She doesn't want scapegoating of our medical team. Quote, "My medical team are my only security. Whatever happens in this inquiry, any damage to them will damage me, and I refuse to allow any further damage. Enough is enough, and I want assurances that my consultant will be able to focus on me and on my care, and not on bureaucracy." So I say counterintuitively, Taoiseach, to the House and to yourself that in the bubble of Leinster House we can go in one direction, but we have to listen to what victims are saying to us, and we must be proportionate. She's saying, be balanced, be proportionate, and above all, keep my needs now as a victim as your number one priority in whatever you do. Thank you, Taoiseach. I think, Taoiseach, it's arguable that the system had time to prepare. That's the point. And didn't respond initially to the Vicky Phelan case as it should have, and that's why we have these panic and rushed measures which haven't been thought through properly. I mean, 7,000 women waiting for a callback. I mean, that's an appalling number, because either the proper thought didn't go into what kind of helpline are we talking about. Is it just a phone line? Or is it actually a genuine helpline that is resourced as such? It seems to me a more primary care-focused response should have been developed. The idea of a clinical review, whether it is, I mean, the free smear test, there's a fee for every GP, for every woman, I presume, that comes back. Yeah, but we're talking about, first of all, trying to get the quality assurance right and getting that confidence restored. And it seems to me that it needs to be thought through. I think women who are at a higher risk should have been targeted first. Working with primary care and their consultants, because there are different categories and some are more high risk than others, and it would seem to me there's an urgent need to focus in on that aspect of it. And thirdly, Taoiseach, a redress scheme was announced last week and no one has an idea what it means. Initially it gave the impression that everybody who was misread was going to get redress. During the weekend, in the papers it said anybody who wasn't told. Again, it seems a bit make it up as we go along, and I think I would like to hear more from you in terms of the logistics of the smear tests for every GP, and also the redress scheme, if you could indicate what is now envisaged by the government on that score.
Taoiseach to